In this video, we are gonna explain which signs are early signs of labor, why they could mean that labor is near, but why you should not rely on them predicting exactly that.
Yes, in fact, we are going to look at two examples of two women from Nathalie's clinic who both experienced the so-called early signs of labor quite differently compared to other women.
Right.
And we do that because we want to prepare you in case that you too experience the early signs of labor differently than most pregnant women do.
Yeah, and then afterwards, we're also gonna share with you the only sign that you need to pay attention to if you want to know for sure if labor is close.
Yes, this is Nathalie, a pregnancy and birth consultant and TCM therapist.
And that's Mathias, a researcher in Science Geek.
And we love helping mummies and their babies naturally and science-based. Alright, so the two examples that we are going to look at are two sisters, Olivia and Emma, who both gave birth to two wonderful boys. And please note that this is not really how Olivia and Emma look like. Their names are real, but we used random images in order to protect their identity, okay? Now, Olivia is a first-time mom, and she gave birth 2 days after her expected due date. Emma, on the other hand, is a second-time mom who gave birth 5 days after her expected due date. Both were naturally induced by Nathalie at the clinic with the help of acupuncture and reflexology.
Yeah, and by the way, when we say they went into labor, we mean active labor as opposed to early labor. Active labor is when you're having those very intense contractions and when you're dilating from about 3 to about 7 centimeters.
Right.
Early labor, on the other hand, may start hours, days, or even weeks before you go into active labor, and you may or may not feel mild to moderate contractions during that stage, as we are going to see.
Alright, so at some point during Olivia's late pregnancy, her husband suddenly noticed that her belly was hanging much lower. Olivia herself, on the other hand, noticed that she suddenly found it more difficult to walk. She started feeling a sharp and shooting pain in her pelvis and vagina, but she also suddenly found it much easier to breathe. What happened was their baby dropped. No, not like that. Baby dropping means that the baby has engaged in the pelvis. It is something that is commonly known as early sign of labor because it is indeed a sign that the baby gets ready for birth.
Yeah. Now, in most cases, I see women go into labor within 1 or 2 weeks after their baby has dropped. However, what most women don't know is that the baby can drop as early as 4 weeks before delivery, which is also what happened to Olivia, whose baby dropped in week 36.
Yes, her sister Emma, on the other hand, is a second-time mom, and she was waiting and waiting and waiting for that baby to drop so that she could finally go into labor. Except that never happened because her baby only dropped once she was already in active labor.
Right.
So keep in mind that particularly if you are a second-time mom, your baby may not drop until hours before or even after you go into active labor.
Right. Now, interestingly, the two sisters also had a similar experience with regard to two other popular early signs of labor, namely the mucus plug discharge and the bloody show. The mucus plug is a jelly-like substance that blocks the cervix in order to protect it from bacteria. But as your cervix thins out and dilates, two things are going to happen. First, you're going to lose the mucus plug. And second, cervical dilation can make blood vessels burst, which can cause a bit of bleeding, in other words, a bloody show. And this can change the color of the mucus plug to either red or brown.
Yes, and so oftentimes it is said that if you lose your mucus plug, and in particular if it is either red or brown because you either have or had your bloody show, then you can expect to go into labor within days because you're obviously dilating, right? And so for many women who Nathalie treated at the clinic, that was exactly what happened. But here's what happened to Emma. Emma lost her mucus plug only hours before she went into active labor. And guess what? It was neither red nor brown as you would expect. It had a clear color despite the fact that she was not only overdue, but also very, very close to active labor. And her bloody show was basically just a bloody discharge, which came hours after her losing her mucus plug and after she went into active labor.
Olivia, on the other hand, lost her mucus plug at the beginning of week 38, and it did have a red color, which indicates that she also had her bloody show.
Yeah.
Still, it took her more than 2 more weeks before she went into active labor.
Yes, so as you can see, both the mucus plug and the bloody show can be signs that labor is near, but not necessarily.
Yeah.
And then from week 36 of her pregnancy onwards, Olivia kept complaining about diarrhea. Now, diarrhea is often seen as another early sign of labor because in order to soften your cervix, your body releases a hormone called prostaglandins.
Right.
The problem with prostaglandins, though, is that it can also cause diarrhea or at least the urge to empty your bowels frequently. And because of that, for many women, suffering from diarrhea at the end of their pregnancy can indeed mean that labor is only just days away, because it can be a sign that their body works their cervix, if you will, right?
Yes. However, that was not the case for poor Olivia. She had suffered from diarrhea for almost 4 weeks before she finally went into active labor. Why can this happen? Well, because sometimes cervical ripening starts several weeks before active labor. Emma, on the other hand, never really suffered from diarrhea. What she did feel though was the intense urge to empty her bowels, but only once active labor started.
Yeah. Now, I'm tempted to say poor Olivia because she clearly took the more painful route here. In fact, another thing that was much worse in her case was her back pain. Now, back pain is probably something that you experience throughout your pregnancy, right? But some women may experience more intense back pain towards the end of their pregnancy, which can be another early sign of labor.
Yeah.
And it is usually particularly an issue in women whose baby is sunny side up, like it was the case for Olivia. So what does sunny side up mean?
Well, usually a baby would move into the birth canal with their face facing mommy's back. But in some pregnancies, it's the other way round. The baby's face faces mommy's belly, which is called sunny side up. When this happens, the back of baby's head can press against the mother's spine and causes severe lower back pain when you're getting close to or when you are in labor.
Don't worry, a baby can still be born that way, and besides, most babies turn during labor so that they are in the correct position.
Right.
Still, back pain is gonna be an issue.
Yeah.
Now again, Olivia's baby was sunny side up, and so she felt this extreme lower back pain throughout the past 4 weeks of her pregnancy. Emma, on the other hand, did not really feel any more back pain in her late pregnancy than she was usually feeling. And so back pain is yet another example of something that could be a sign that labor is close, but not necessarily.
Yeah. And then finally, both Olivia and Emma felt very strong Braxton Hicks contractions, which gradually changed into mild contractions during the days and weeks before active labor started. Braxton Hicks are basically false contractions, which you may have felt throughout your pregnancy. And if you're not sure how to distinguish them from real contractions, watch our video in which we explain just that.
Yeah. Now, the way it normally works is that you may experience an increase of Braxton Hicks contractions during the final days leading up to real labor. And then normally the Braxton Hicks contractions would gradually change into mild but real contractions, which come in more or less regular waves. These mild but real contractions are a sign that you entered the early stage of labor. And then once you are in early labor, normally it is only a matter of days, sometimes hours, until you are in active labor. And because of that, both an increase of Braxton Hicks contractions as well as mild real contractions are seen as early signs of active labor.
Yes, and again, this is basically what happened to both sisters, although at very different times.
Yeah.
In Emma's case, the Braxton Hicks contractions started to feel much more intense once she was in week 39. Then from about week 40 onwards, they gradually changed into contractions, which were more frequent, more regular and more intense, but still mild compared to the contractions that she finally felt in active labor. In other words, her early labor started just days before she received acupuncture and reflexology, which sent her into active labor.
Olivia, on the other hand, felt an increase of Braxton Hicks contractions already in week 36, and then they changed into mild real contractions in week 37. So it is likely, and her midwife confirmed that, by the way, that Olivia went into early labor in week 37 already. This means that she was feeling mild real contractions for almost 3 weeks before she went into active labor.
What does this mean for you? Well, first of all, when you feel an increase of Braxton Hicks contractions at the end of your pregnancy, and in particular when you feel more or less regular real contractions, then those could indeed be signs that active labor is near.
Yeah.
However, as we have seen, even when you do feel an increase of Braxton Hicks, and even when you go into early labor, it does not always mean that active labor is very close.
Yes. Now, at this point, you may ask yourself, okay, but if not even real contractions can reliably tell me that I'm about to go into active labor, what then? Well, the sign that can indeed reliably tell you that you are about to go into active labor are real contractions. However, only if they fulfill certain criteria.
Yes, so when you're feeling real contractions, which are only just mild or moderate intensity-wise, and which come in more or less regular intervals, then what you need to look out for is a change in that pattern. So at the beginning of the early stage of labor, the contractions may only just come about every half an hour. But towards the end of early labor, they are going to become more intense, they are going to last longer, become more frequent and more regular.
Yes, so what this means is that throughout the early stage of labor, the duration of your contractions is going to gradually change from about 30 to 90 seconds to about 45 to 60 seconds. And the frequency of your contractions is going to change from about every 30 minutes to every 5 minutes. Plus, your contractions are going to become more intense. So as a rule of thumb, once you feel very intense contractions that last about 45 to 60 seconds and come back every 4 to 5 minutes, then you are in active labor. And so the only sign that can normally indeed reliably tell you if active labor is only just days or even hours away are real contractions if and only if you observe that change in pattern in terms of their intensity, regularity, frequency and duration that we just described.
Alright, so we do hope that with this video we could reduce your concerns and fears so that when you observe those early signs of labor, you understand that they are just your way of experiencing them, which may or may not be different from how other women experience them.
Yes, but please keep in mind that if you're having any doubts or concerns, the right thing to do is always to call your midwife or doctor.
Yes. If you have found this video helpful, we would be super grateful if you could leave us a like or even share our video with others.
Yes, and for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.